There is a bacterium that, according to the latest estimates, lives stably in the human stomach of at least 2/3 of the world's population. In most cases, it does not cause any symptoms, so many people live with it their entire lives without ever knowing. In other cases, however, this bacterium can cause chronic gastritis and gastric or duodenal ulcers, and it can also increase the risk of certain cancers, particularly stomach cancer or a rare aggressive form of lymphoma. But what bacterium is it? How is it discovered? What symptoms does it cause? How is it transmitted? And how is it diagnosed? Let's find out together. In 1982, the two Australian doctors Robin Warren and Barry Marshall isolated for the first time from the human stomach a bacterium believed to be responsible for the vast majority of gastric and duodenal ulcers. It is Helicobacter pylori, a spiral-shaped bacterium equipped with flagella or small tails, which allow it to move and embed itself in the stomach lining, resisting the action of gastric juices. It is mainly transmitted through direct contact with the saliva, feces, or vomit of an infected person, but also through sharing glasses or other contaminated objects. Other possible routes of transmission include the ingestion of food and water contaminated with human fecal material, especially in developing countries, where hygienic conditions are poor and access to drinking water is limited. Although in most cases Helicobacter pylori infection is asymptomatic, in some cases it causes a range of gastrointestinal disturbances. One of the most frequent is a sensation of pain or discomfort in the upper abdomen, which tends to worsen when the stomach is empty. This is because gastric juices, not buffered by the presence of food, come into direct contact with the already weakened stomach lining. Once food is eaten or antacids are taken, the pain tends to subside, but only temporarily. Other commonly observed symptoms include heartburn and gastroesophageal reflux. In the first case, there is a burning sensation in the stomach, which may radiate to the back. In the second case, the stomach contents flow back up the esophagus toward the oral cavity. This happens because Helicobacter pylori weakens the protective lining of the stomach, allowing acids to damage and irritate the gastric mucosa. Other possible symptoms include nausea, vomiting, loss of appetite, and difficulty digesting food, all of which significantly reduce patients' quality of life. In more severe cases, Helicobacter pylori can cause gastritis and ulcers in the stomach and duodenum, the first part of the small intestine. In gastritis, there is inflammation of the stomach lining, while in ulcers there is a true lesion or wound, varying in depth, in the inner lining of the stomach or duodenum. Severe consequences may include bleeding, perforations, and obstructions due to scarring of damaged tissues. Helicobacter pylori is capable of resisting the action of gastric juices thanks to the production of a particular enzyme called urease, which can break down the urea naturally present in the stomach into ammonia and carbon dioxide. To diagnose a Helicobacter pylori infection, a simple and safe test called the urea breath test is performed. Initially, the patient is asked to blow into a glass tube to collect a sample of exhaled air. Then, the patient drinks a solution containing C13, labeled urea, a non-radioactive carbon isotope. After 30 minutes, the patient blows into another tube to collect a second air sample. The two samples are then sent to a specialized laboratory to detect the presence of labeled carbon dioxide in the exhaled air. A positive result indicates that the bacterium is present in the stomach, confirming a Helicobacter pylori infection. Alternatively, tests can be performed to detect bacterial antigens in small stool samples or in a blood sample. In the latter case, however, a positive result does not distinguish between a current or past infection. The most complete, but also the most invasive test, is a gastroscopy with biopsy, which allows fragments of the stomach lining to be collected and analyzed in a laboratory to verify the presence of the bacterium. In conclusion, Helicobacter pylori does not cause symptoms in most people. If symptoms do appear, it is necessary to consult a specialist. Usually, patients are treated with a combination of antibiotics and proton pump inhibitors, drugs that reduce stomach acid production, making the environment less favorable for bacterial survival.